Welcome back. Thank you for coming, Dr. Ballard, to our
You're
Women's
welcome.
Wellness series. I'm so excited. I've interviewed Dr. Ballard in the past because she's a wealth of knowledge. Not only is she another certified pediatric chiropractor, but she also has functional medicine. What do you call it? Functional medicine practitioner.
Yep.
Because she works with the kids and she works with their tired parents. But also her and I chatting even about some of the specialty cases that she takes care of, even some genetic issues and more of the epigenetic things that we're starting to see. So a really amazing things that she does over in central Illinois. And here's the thing with technology. Not only can we do these sort of interviews that we're doing right now and be side by side, but she's able to do the same thing with her patients. And we've sent a ton of patients over to her to help. Not only have we saved several gallbladders, thyroid, hormones, pituitaries, marriages, I'm sure of it.
Just a few of those.
Right? I can't even imagine. So a lot of what we talk about is with hormones and females and cycling and adrenal fatigue. So what we'll find is I'll say, oh, Dr. Ballard, I've got this case. She's got, XYZ. I'll have her set up an appointment, and then they get over to Dr. Ballard's office and see that some of the testing they were taking was inadequate. It wasn't what they needed to get the answers that they wanted. So she's going to kind of run down for us with what kind of testing you want to have so you can figure out and get the answers that you want so you can get the help that you want. And I would say this is a pretty under talked about and utilized topic because a lot of people think you can get all you need from blood, and that's not quite true, or at least what we need to draw specifically from the blood. So so Dr. Ballard, why don't you just let us give them the lowdown that you and I were talking about earlier.
Yeah. So this is work that I do in my office on a daily basis, and it's work that I absolutely love. So anytime I have a new patient in, one of the very first things that I do as a provider is request all of their records. And I know when I say all of them, I mean like as much as I can get. I always prefer more information than less. The next step for me is to review all of that information, and then I do what I call writing up their labs. And so I transfer all of that laboratory information to like easy tracking sheets for myself, because then I can look across multiple dates of service all side by side. So I can see if you had a lab that was outside of ideal, that was just a moment in time, or if it's a trend for a person's body. Often I'm left with more questions than I started with. So I'll see a person has had a TSH test done to check their thyroid, but we never checked T4 or T3 or any of their antibodies or their T3 uptake, and all of these labs that are just insufficient. Like I've had multiple people come in with thyroid problems long-term. I checked their antibodies and they're fully into Hashimoto's and had no idea. Why is this relevant? Well, it's not if you're a medical doctor, because you're still going to treat Hashimoto's the same way that you would hypothyroidism, which is usually with something like levothyroxine. However, if you're a functional medicine practitioner, you're going to recognize that once you have one autoimmune disease like Hashimoto's, you are statistically 3 times more likely to develop another. So I need to stop that autoimmune process, work on immune system function just as much as I need to work on the thyroid. So these tests are super important to me. And I really have to sometimes go in and fill in the gaps. So I find myself a lot of times either writing requests to another medical doctor out there in the world saying, hey, would you help this patient procure these tests? Or I'm drop shipping test kits. And really for me, what it does is slows down the process a little bit. I want to be able to find you guys answers as soon as possible, put a plan in place immediately. And sometimes I just can't because I don't have all of the pieces. So that's what I really wanted to dive into today. And I think just going to kind of work through some of the bigger things I see in my office and the big complaints that women come in with, which I say women, but men sometimes too, so that if you guys are going, okay, I need some more help and I want to dive deeper into figuring out what's going on, that you can go, okay, I know that I should be going back to my provider and asking for this test, and this test to at least fill in the blanks. The other thing I want to mention to you though is sometimes your provider is going to be like, that's not necessary. And this is the thing. These are your labs. It's your health. It's your care. So if you come up to a provider that's not interested in helping you get more testing so you can figure out what's going on wrong with your body, it's time to switch providers. It's your body, your health. They work for you. You don't need their permission. You just need their assistance. So I'm going to step off my soapbox.
Good point. Right. Very good point.
Yes. So I think first and foremost, I'm going to dive into, I want to talk about the kind of the big hormonal groups, if you will. So I'm going to talk about how we properly test the adrenals, how we properly test female hormones, how we properly test the thyroid, and then how we properly test general health. So I think the very first one I want to hop into is talking about female hormones, because more often than not, those are the types of cases that are coming into my office. And I know, Christy, you and I had talked about the symptoms that people are usually complaining about, and there are countless. So most of the time, I have people in with hot flashes, night sweats, cycle irregularities, heaviness, cloudiness, really painful cycles. Infertility cases are relatively common and probably will become more and more common if you're following some of the alternative news sites. So you know what I'm talking about. But there's definitely a way to properly test female hormones or to do like a PCOS panel or those type of things. That's just not happening in conventional medicine. So to understand how to properly test, if you will, the first thing I need to explain to you is the difference between a free hormone and a bound hormone, which are probably not things that you've ever heard talked about before. So anytime your body produces a hormone, there's a portion of it that's going to get stuck to a protein. That's not a usable hormone. It's floating around in the body, but it's stuck to a protein. So it can't land on receptor sites on a cell to make that cell utilize that hormone. So we recognize this when we're looking at thyroid hormones. So if you have had thyroid problems, you probably are familiar with TSH, which is the hormone they check first. And then sometimes they'll test T4. Now, if you've ever looked at your labs, it might say total T4 or free T4. So total T4 is all of the T4 that your body produces. Free T4 is what's left after some of that gets stuck to another protein. That's the portion that your body can't use. So the free version of hormones is much more, it just gives me a much better idea of what your body actually has to work with. The unfortunate thing when it comes to female hormones is that testing for the free hormone level is not widely done. And when it is, it's expensive, unlike thyroid, which we're going to talk about in just a minute. So whenever we're talking about female hormones, a lot of times I'm having people who want to evaluate their estradiol. Sometimes we'll get into estrone and estriol, but not usually. Usually it's just estradiol that's checked. We also will check our progesterone. Sometimes we'll check DHEA. But for the most part, it's only ever the bound version of that hormone that's tested. And while it can give me an idea, it's not nearly as good as a free hormone level. So like I just said, we don't do that in blood a lot. So how do we test our female hormones and do it in a way that's really meaningful, that's going to give us the most accurate information? Female hormones are best tested with saliva or with urine. So there's a couple companies that I use, and I just want to mention to them to you because there's lots of practitioners out there that utilize different companies. I mean, there are a bunch of different saliva and urine testing companies, but I just want to share a couple of my favorites so you can hop onto the websites and learn a little bit more about their testing if you're interested. So probably the best out there is a company called Dutch, and that stands for Dried Urine Testing. So it's DUTCH. You can look at DutchTest.com, and it's a combination typically of saliva and dried urine. So the saliva samples are particularly good at showing us the free or available version of your estrogen or your progesterone or what have you. They also do urine testing. And why in the world would you need to test urine if you're already getting your answer in saliva? The answer is metabolites. So every time your body utilizes a hormone, it processes that hormone, breaks it down into smaller pieces. And those metabolism pathways are different for every person. So some people might be metabolizing down a safer pathway that leads their body away from increased cancer risks. Some people might be metabolizing towards that increased cancer risk. When we look at male hormones, we have something called a 5-alpha pathway and a 5-beta pathway. One is much stronger in male symptoms, if you will, and the other one is less so. But if I know how your body is actually processing your hormones, that might change the way that I supplement you. So I just mentioned this, and I know that these are like new terms. It's okay. You don't have to know the terms. I just want you to understand the concepts here. So when we're talking about testosterone, so we've got testosterone here, and your body processes it down two pathways. Think of it kind of like a fan wheel. We're going to go this side, or we're going to go to this side. So we have the 5-alpha. So when you have testosterone and your body processes it, if you send it more towards the 5-alpha pathway, that's the more androgenic side, which just means that you have more of a testosterone response if we jump that direction. So for my body personally, I tend to trend a little bit lower in testosterone, but every bit that I process goes towards the stronger side. So I could just look at my testosterone in a lab and go, ooh, testosterone's a little low. But if I supplement myself, it's all going to go to that stronger side, and I might end up with excess testosterone symptoms like aggression and acne and hair.
So body hair.
Fun. We love that. Everybody an acne-riddled, aggressive, hairy monster in their face as I'm adjusting them. These are important things to know. So this is why I ever use Dutch testing, because I can see how your body's actually processing your hormones. I can see how your adrenals are processing your hormones. I can see exactly what we're doing with our estrogens as we process it through our liver, because livers are important when it comes to hormones. But that Dutch testing is excellent. It's also probably our priciest option out there. So if we want to look at just saliva, but not necessarily the urine metabolites, I use a company called Diagnostics. So Diagnost and then text T-E-C-H. Diagnostics.
So, Dr. Ballad, when they're going on these websites, are they're able to order their own testing and it's going to come to them and they're going to fill it out at home? Or is this something that they're saying, okay, I've got the information, now I'm going to talk to a doctor about ordering it for me?
I would take the information, talk to a doctor. And in truth, this is where things get a little bit hairy, because a typical medical doctor is not going to have significant exposure. Even endocrinologists, when you go to an endo and they want to look at your female hormones, or you go to your OB-GYN and they want to look at your female hormones, they're going to use blood. And right. This is the other tricky thing about blood. Whenever you get the report from blood-based hormone testing, there's going to be a reference range, especially when it comes to female hormones, or any of your reproductive hormones like LH, FSH, sex hormone binding globulin. There's going to be ranges, but a lot of times those ranges are going to vary based on where you're at in your cycle. But the problem is they don't record where you're at in your cycle anywhere on the lab report. So if you have labs in February and I get the report, I have no idea if you're on day 15 or if you're on day 28 or if you're on day 5 of your cycle. And that matters significantly to the way that I interpret it as normal or abnormal. So it's tricky. Anytime you are working with a provider, I would highly, highly, highly encourage you to keep track of your cycles so you can give them that information. I as a doctor can only work with the quality of information that you give me. So the best way for me to do a crappy job is to get crappy information from my patients or from my patients' doctors. So that's just something I want you to be aware of. In my office, a lot of times what I do is a combination of using these different methods so that I can be the most cost effective for my patients, but also get the best information. So fortunately with Dutch testing, that looks at how your body naturally on its own processes your hormones. So if I'm not changing your genetics, I'm probably not going to change the way that your body processes those hormones. So I can start off with a more extensive, little pricier test, and then maybe follow up with something from Diagnostics, which isn't quite as pricey, but still gives us the same information. So that's how I prefer to test female hormones. I like to do it in saliva or in urine, and I like to use those two companies. They're kind of two of my favorite. There's another big player out there that's called ZRT. A lot of pharmacists and compounding pharmacies will use them. I just have always used Diagnostics. So it's not that these companies are bad. It's just the ones I'm most familiar with and can give people the most advice when it comes to this is the way to check. One other thing I want to mention, and I'm going to hop on to talking about thyroid, is that whenever you're looking at testing options, whenever we're testing female hormones, we can test like a moment in time, which is usually towards the end of a cycle, like day 19 to 22-ish. Or we can test if you're having infertility issues, you can actually sample and test every couple days throughout the length of an entire cycle so that we really know what your body's doing and when, So we know how to supplement you or support your body to do its very best job when we're trying to conceive. So there's lots of testing options out there, and they're probably more advanced than most people realize.
Well, then I remember you looking at ratios too. Like it may appear that your estrogen's high or your testosterone's high, but the ratio's right. And all the things that I've learned from you are pretty amazing. And they don't look at those kind of details. And those are important. And not only going to help you decide, like she's saying, with how to supplement, but how to support your own body. And that's really what functional nutrition and functional medicine is supporting your own body to do its process, not supplementing in a way to force it to do something it can't.
Yeah, that's always my goal when I do functional medicine work. I don't want to give you a supplement for every problem that you come in with. I understand sometimes we have got to manage symptoms right off the bat. Like if you are having your cycle and it's like a crime scene every month, I don't want to get that under control for you. But I also know that I'm going to maybe have to work with the HPA axis communication from body to brain. I might need to go back and get the liver going. And it might be something like, you have chronic constipation. Well, I have to fix that before I'm ever going to really truly stabilize your hormones. And so I want to get to the heart of the issue, correct those things, but also give people symptomatic relief. And part of that is testing correctly, follow-up testing correctly to know we got the job done.
Yes.
Which thyroid hormones, this is another big one because thyroid hormones, they are tested all the time by everybody from a general practitioner to like therapists. Be like, oh, I think your thyroid's off. So people are testing for thyroid issues all the time, but the testing tends to be super incomplete. This is one set of testing that I say, do it in blood. It's fine. It's totally fine. You can get the information that you want and do it from blood. So most people are familiar with the TSH test. So that stands for thyroid stimulating hormone. Most of the time, thyroid testing is it's not that it's underperformed, it's that there are multiple tests that should be included in a thyroid panel that are not. So most of the time, if we have a thyroid test, it's TSH, again, thyroid stimulating hormone. Where does that come from? It comes from the pituitary gland in the brain. So a few minutes ago, you heard me mention the HPA axis. You have a gland called the hypothalamus. It acts as a big funnel, kind of sits like this, collects information from the body, and then sends it down to the pituitary gland, this guy right here. Those are inside of the brain. From there, the pituitary sends out marching orders to the rest of your hormone systems. So it's going to talk to your adrenals, your thyroid, and your ovaries and uterus, or your adrenals, your thyroid, and your testes if you're a man. So whenever this communication is happening, the pituitary tells the thyroid what to do through TSH. So it's not really a thyroid hormone so much as it is a pituitary hormone. The thyroid is then going to respond by producing T4, which we talked about a few minutes ago. T4 is really abundant, but it's not super active in the body. So there's a lot of it, but it's just kind of laying around, doesn't do a great job. Some of it is stuck to a protein, and that's called the bound version. Some of it is free floating in the body for your body to use, and that is the free T4. So when we are testing, I can test TSH, I can also test total T4, and I can test free T4. And I like to look at free T4 more than I like to check total T4. So I always do I actually always do at least 3 tests for the thyroid. After we make T4, the thyroid makes T4, we send it off to the liver. We shunt it right down and we convert it into something called T3. So T3 is less abundant, there's less of it, but is way more active than T4. So if you're tracking with me, we would be checking our TSH, our free T4, our free T3, and then we also can go back and check total versions, total T4 and total T3. If you have had a history of autoimmune disease or you've had thyroid problems for a long time, I always think it's a wise decision to check out antibodies. So autoimmune processes are going to start when we have a tissue that's repeatedly damaged. It's normal that we have some autoantibodies. If you damage a tissue, we want our body to be able to flag a damaged cell and then go get it. So having some thyroid antibodies around, not a big deal. We all have some antibodies to our own self that help us clear up dead tissues. When those start to get out of control, that's when autoimmune processes really can run rampant. So in order to check for something like Hashimoto's, you want to run something called thyroid peroxidase antibodies or TPO antibodies. So that's a test that I do every time I have a thyroid, a patient with a thyroid problem. That's one of the first tests I do. And if it's negative, I don't worry about rechecking it usually for about a year unless symptoms were to really go crazy.
So is that in the normal test, Dr. Ballard? Would you find that in a blood test if they went to their medical doctor, or do they have to say, please test for TPO?
Almost never. I almost never see free T3, and I almost never see thyroid peroxidase unless a patient has done some online research and specifically asked for it. Even patients who have been with endocrinologists and with endocrinologists long term, I will still not see that those autoimmune panels have been checked at all. So the thyroid peroxidase is, and it's especially through the lab that I use, it's inexpensive. Of course, you have to be local to use my lab, but it's inexpensive. It's like $11 to do this test. So this is something that easily can be checked in blood work. There's also thyroglobulin antibodies that we can check, and thyroxine binding globulin. So TBG and TGB. So I know that's getting into some things here, but I sometimes will check those as well. And like I say, I usually will check them and just check them once. And if they're not positive, I try not to worry about it too much. There's two other tests that I check often. One is called T3 uptake. So if we are producing T3 and it's supposed to be abundant and help our cells run all the thyroid processes well, then what we need to make sure is that we're absorbing that T3. So that's what T3 uptake is looking at. Then we also have something called reverse T3. So T3, think of it like a gas pedal for our body. And we talk about gas and brake pedal a lot as chiropractors. But T3 is a gas pedal for us. Under times of increased stress, we don't need to be hammering away at that gas pedal. So what our body will do is recognize that and go, you know what, we need to take some of this T3 and put it over here so we're not hitting the gas too hard. That's our reverse T3. So that should be within a certain range too. If we are sky high in reverse T3, stress responses are maxing out our bodies. So these are things that are useful to me, especially as I'm trying to figure out the way that these hormone systems are working together. So when you're doing a thyroid panel, I'm going to run through them one more time for just so that if you're making notes, you can write these down again. So a very common basic panel is going to be TSH, free T3, free T4. If we want to really get into everything, in addition to those I just mentioned, we would run thyroid peroxidase antibodies, TGB, TBG, our reverse T3 and our T3 uptake. So
and
that
can they typically get that on one blood panel, or are these separate vials? Okay, so that's really great news.
Yeah, and usually you can do for like every vial that you have, every test is a little bit different as far as blood collection requirements are concerned. But for the most part, you can get 2 or 3 tests or 2 or 3 panels out of a single vial. So I know it sounds like a lot, but you can probably get all of that out of a single vial.
Well, and I know you and I were talking about a lot of this often is a reflection of a high stress lifestyle. Sometimes we don't even know that we're high stress because we're just so used to it. That's just who we've become often. So if somebody was struggling with their health, how would they know that their hormones are off or their thyroid is off? Where do you usually tell them to start?
So a lot of times I'll start with kind of really general blood work, and then good listening, like active listening for these patients. So if I'm hearing a lot of like those, I think we all can kind of recognize the female hormone symptoms with our cycling issues, heaviness, cloudiness, painfulness, our hot flashes, our night sweats, those sort of things. If I have a patient that's complaining a lot of fatigue, of foggy thinking, cold hands, cold feet, dry skin, metabolic issues, I worry a little more about their thyroid. When we're having issues with anxiety, fatigue, sleep issues, I start to worry a little bit more about the adrenals, especially if a patient's been living a really high stress lifestyle or they've had a lot of increase in stressors lately. And I go, how are those adrenals doing? Because adrenals will prop us up. So as we start to age and our female hormones start to die off, we really rely on our adrenal glands to help us produce our female hormones when our ovaries and uterus are like, listen,
I've had my time, right? I've had my time.
I've done this. So I'm going to take a break here. So we will tax our adrenals, especially later in life. And it's important that those are strong. So a lot of times we recognize it, and sometimes you can get your medical doctor to do like what's called a 4-point cortisol, where they're checking your cortisol at multiple times through a day. That's excellent. gold standard for checking out the adrenals and seeing how they're doing is saliva testing. Dutch test that I mentioned earlier, they do look at metabolites of the adrenal hormones in the same way that they do for female hormones. And they do have comprehensive panels where you kind of look at all of it. So like their Dutch Plus is like that, where you can look at female hormones, male hormones, and adrenals all in one panel. Diagnostics has something called an adrenal stress index panel, and they're not terribly expensive. I think that test is like $125-ish. So you can get a really comprehensive look at the adrenals, but the best way to do it is in saliva. So you spit in a little tube at multiple points throughout a day, but your adrenals we should see those hormones rise and fall in a pretty predictable pattern, unless our adrenals have been living in a stressed out state for a significant amount of time, in which case you just don't get the same level of response. They're like, I'm so tired. Here's a little bit. And that's it. And so those patients a lot of times will complain to me. They get up in the morning. What we should have is something called a cortisol awakening response. So our cortisol rises first, like within the first hour of waking, and that helps to get us going in the day. So, and a lot of us are supplementing with stimulants like caffeine. Like, just saying, this is not judgment here. I'm just saying. But what I'll notice is that my patients with a lot of cortisol issues and adrenal issues, by the time we get to 10 o'clock, they could go back to bed. And you're like, I've been up for 2 or 3 hours and it's 10:30 and I'm just barely making it. And then they kind of get over the hump and they do better through the rest of the day. They also usually not the best sleepers in the world, but the really great way to test is not with blood. And I really think that the salivary cortisol is the way to go. And we want at least a 4-point cortisol. If I can do a test an hour after waking and make it 5 points, I'm even happier. But that can be done through Dutch. It can be done through Diagnostic Solutions. It can be done through ZRT. Or I'm sorry, not Diagnostic Solutions. That's stool testing. That's a whole different can of worms. But through Diagnostics or ZRT labs. So that's really how I test hormones for the most part. Sometimes in blood, a lot of times through saliva. And there's just one other thing I want to talk about, which is how we test kind of general health. Like, I just want to make sure I'm doing the right things for my body, and how do I support it in doing the most ideal things that it can be doing. So I'll have patients ask me, especially since I take care of kids, sometimes we just want to know, like, what multivitamin do they really need? What are we actually looking at here? In which case, some really basic labs can be helpful. So if we were to do blood work, I would be looking at a metabolic panel. Metabolic panel is going to show me your body's electrolytes, but also more digestive capability and function. I want you guys to know that your blood work, your body is going to sacrifice a lot to keep your blood balanced. It just will. So if we're starting to see things off in blood, it's a more significant problem than we typically give credence to. So like if your blood calcium is off, I'm gonna be more concerned about that than it being like, oh, it's just a little high, it's a little bit low. No, what's up there?
What's going
What
on?
has been going wrong so long that now we can't even keep our blood balanced, because we will sacrifice to keep that blood balanced. So I will usually do a metabolic panel to look at electrolytes and then digestive function. I'll look at what's called a CBC, or blood count. That's going to show me signs of chronic infection, whether it's viral, bacterial, or parasitic. It's also going to show me your iron status. So we don't pay enough attention to iron, especially women who are cycling. But if you're struggling a lot with fatigue, or you're struggling with mental health issues, iron is a foundation for some of our neurotransmitters. So make sure that iron is good. If you want to look at iron itself, I like an iron panel plus a ferritin, which is stored iron. Sorry, my computer dying. So I'll add that, an iron panel and a ferritin. I also will usually look at vitamin D because it's so essential to immune system function. And I'll do a cholesterol panel to look at how we're processing our fats. How we process our fats can give me a good idea of how that thyroid is doing too. So if I'm not going straight to thyroid, I'll sometimes add in a lipid panel. I already told you guys about the thyroid testing that I do. Now we've got another option too. So if we have a kiddo and we don't want to go straight to blood work because we want to avoid needles, a really great way to look at your body's kind of nutrient health, if you will, is to do something called a hair analysis. So you actually take little snippings of your hair, and you want to do it by the scalp. So you literally, even if you have hair down to your butt. You're going to take the sample at the scalp and then take that first inch of hair, because that's going to be about the last like 4 months or so. And you just snip the hair and you send it off for a look at the mineral composition of your hair. Hair analysis is really reflective of the mineral composition of a body.
I actually have bags of hair right now where I'm doing a follow-up for my family.
Hey, see? Hair analysis is really good to look at your body's mineral composition. I will say this though, you really do want some guidance from a practitioner, especially with hair analysis. There is minutia when it comes to hair analysis, for lack of a better word. And nothing, I will repeat this, nothing in the body works independently, ever. Absolutely. So if I just look, I see calcium is low. If I just start supplementing, hammering away at your body with calcium, I'm going to screw up magnesium, because the two work in concert together. Zinc and copper are going to work together. Iron, manganese, and copper are going to work together. Which I know I just said zinc and copper and then iron, manganese, and copper, but just trust me, they all work together. So we can look hair is an excellent way to look at heavy metal toxicity. I think the best lab out there is one called ARL, which is Analytical Research Labs out of Arizona, I think. I can't quite remember where they're from. They don't wash their hair samples. Lots of labs will wash their hair samples when they receive them, which can make things a little bit tricky. If you use, oh my goodness, soft water, the chemicals that we use, or the salt that we use to soften the water, can deposit on the hair, so that can mess things up. So we have to wash with hard water for a few days before. Or if you use something like a Selsun Blue or a treated shampoo, colored shampoos are more of a thing now than they used to be, or like the overtone, so that you can change the color of your hair with shampoo and conditioner. Those things would have to be discontinued a little bit to do a hair analysis, but it's an excellent option that's completely pain-free in order to test general, like basic mineral composition, and then heavy metals. And based on how the minerals work together too, the ratios of the minerals, you get an idea of body function too. So for example, calcium and magnesium work together to help regulate blood sugar response. Sodium, potassium work together to control adrenal responses to stress. So there's lots of different testing options out there. And hopefully this helped you guys to kind of narrow down, okay, if I go back to my MD, I want to ask for this test, and this test. And then I'm going to try to find a hair analysis doctor out there to dig into this as well.
Yes. And even this one, you get online, it's fairly inexpensive, and it's not a complete, it's not a diagnostic by any means, but it's going to give you an idea if there is an imbalance, that you're going to want to take it somewhere to get looked at as well. So I think it's good. Like you said, the one that we did checks gut health, it checks vitamin levels. I mean, there's a lot of things that can find out in hair. And I think I paid $25 a test. So it's not going to give me exact numbers, but it's going to give me a good idea of like, oh, yep, here's what's going on. And some food sensitivities. I think 900 foods it checks for. So
yeah. And it's for them being non-invasive, for them being pain-free, it's excellent information. And there's just one little note I want to make about hair analysis. This is where it's some interpretation, and why I say, work with somebody that is used to looking at these things. Sometimes you'll see, as your body's detoxifying a particular thing, like heavy metals in particular. So say you have a fair amount of aluminum we get aluminum at a lot of different places. But say your body's high in aluminum. If I go after that and I say, okay, I want to really help your body detox aluminum, the next hair analysis, you may see that shoot up. Because your body's getting rid of some of it, and then it'll fall back down. So there's some finesse to hair analysis, but it's a really a useful tool. So something I think worth mentioning, especially if we really want to work on maximizing health and not just medicating symptoms or that kind of thing. It's a great way to go.
That sounds awesome. Well, and really we talk about quite often living your best life, having your highest life experience. And sometimes we don't even know we might be missing out on an energy or some sort of production in our body that we could be reaching a higher potential unless we're looking for it.
Yeah.
We don't even know, like, oh man, my life could be so much better if I did whatever, XYZ, whether it's food related, mineral, vitamins, or just as we were talking about in some of the other episodes, your mental health, the way you take care of your body, the way you talk to yourself, how much you move your body. And of course, as both of us are pediatric chiropractors. We're looking at a body that's growing and able to communicate with itself, sound mind and body and free of interference. It's been amazing. And I know Dr. Ballard sees miracles in her office like we do. It's amazing to watch what the body can do given the right environment. And
it really is. And I think, just a little bit of guidance here and there to make sure that we're all on the right track. And I will repeatedly have patients tell me, especially if, say, I get labs back and their inflammation is super high, and then we start to work on low inflammatory lifestyle things, and that drops way off. You don't even realize sometimes how poor you feel until you feel better. And you're like, oh my gosh.
Yep.
If you have a ton of chronic inflammation, your body expends extraordinary effort every day dealing with that.
Sure does.
So if we eliminate that, you have all this energy, all this extra energy that you're like, who knew? That's crazy.
Yeah.
And it's so wonderful to watch those transformations in your practice.
It really is just making the world a better place, one person at a time. It's such a fun thing to do and experience and be a part of. We get to be the guide, like you were talking about before, just help guide them along and living their best life and making sure that we do stuff like this. Talk to somebody if we feel like there's something else going on inside of our body, not waiting, because we're going to see it in the blood. Like you said, your body is going to make sure that blood is as healthy as it can be. If it's going to feed all the tissues in your body, there's no way it's going to want to carry around other crap that's unneeded or not necessary or toxic. And we talked earlier with Stephanie Terrell about getting a breast therm and a baseline for breast thermography and looking at that active metabolism inside the breast and how hormones play a role there, which I know you refer your patients out for breast therms as well.
Yeah. We do. Actually, we have the good fortune that the thermographer we use travels. And so we get to host once a quarter. She comes to the office for our patients. It's been really a wonderful tool. She actually just created a new evaluation panel, I guess, if you will, for the aging body. So she looks specifically at, like, I'm going to do breast, but I'm also going to check out the thyroid, and we want to check out the adrenal. So she does like really specific areas of the body to help. But once you kind of start down this path, you'll realize there are so many options for not just how we start to screen for pathology or screen for disease, but how we can start to actively screen for health.
Yep.
And so then we can start to pursue health in a very different way than we've been able to in the past. And that makes all the difference when we're talking about transforming health. We're no longer just waiting for symptoms to develop and waiting for us to fall somewhere on that spectrum of disease process. But we can go, okay, before I ever get to diagnosed, I can start to stop the process and set those dominoes back up. So till we get to that point where your body truly is at an elevated state of health.
Yes. Oh my gosh. I love this. This has been awesome. I'm glad to have you on again.
Thank you.
Yeah. And you will have Dr. Ballard's information on here for her website. If you want to make a new patient appointment, like I said, we're able to do it online, and we send a lot of patients there, and we will ask, sometimes we can fill out the testing. Sometimes it's their medical doctor. It just kind of depends on how the person and the situation and what we're dealing with, which has been fantastic. We also talked to Keto to Go. We talked a lot about health and blood sugar levels inside of the body and making sure that your body doesn't become insulin resistant. And also our mental health with Brenda Lee. So we are ending this May Women's Series actually in June. We're going to have an event on the 3rd on a Thursday. We kicked it off with a yoga and meditation and intuition exercise, and we're ending it with a HIIT workout and learning about essential oils and more of like helping to change your genes, like you and I were talking about. How do you?
Yeah.
Yes. And some other health tips from Dr. Stormy and I. So thank you so much for being a part of this. I know you're so wonderful at explaining it. You have knowledge, and it's really helpful to sit down with somebody that is not covering up symptoms or looking at the functionality of the body. So I appreciate your time, and thank you so much. I
learned a few things and scribbled notes like crazy as I rattle off all these abbreviations.
Right. I'll just watch the video over to take the notes. So I'm like, I could keep taking notes, but I'm not going to. So thank you so much for your time, Dr. Ballard. And I appreciate it. You have a wonderful day.
You guys too.
Thank you.
Good health.